Our fourth panel will have the Children's Advocacy Center and DCFS. And before we start, who is Shar? You're Shar. Thank you for taking my call the other day. So it was very helpful. And with that, we'll let you decide who's going to start. And thank you for being very patient. This is taking a little bit longer than what we hoped for, but we're not surprised. They usually take a little bit long. So with that, the floor is yours.
All right, I'll give it a shot. I'll start. Thank you so much. Good afternoon. My comments say good morning, so we're changing it to good afternoon. I'm very appreciative. I'm Shar Rivette, the Executive Director of Chicago Children's Advocacy Center, and I do appreciate all of the time that you're taking here and the number of hours that you're taking out of your very busy schedules to listen to the testimony today. And even though it's been a long day, it's really been good for me to listen to the testimony so far today, just in my work as running the Chicago CAC and my work as an advocate in the state of Illinois to make sure that we can learn and move forward and do the right thing, from a CAC perspective as well. I will not read everything in my testimony out of the interest of time, and a lot of the things that I was going to bring forward have been spoke about already, but I want to say a few things, obviously. First of all, Chicago Children's Advocacy Center is the CAC for the City of Chicago. We are a collaboration. We're a not-for-profit, but we collaborate with Chicago Police Department, DCFS, the Cook County State's Attorney's Office, and also the Cook County Health and Hospital Systems. We have specialized units of each of those departments that work in our building with us. So we're co-located. We're on the west side of Chicago, the Illinois Medical District, and we have a protocol, and we have a working relationship that we investigate all cases of child sexual abuse in which both DCFS and the police are involved. And we also do any case of sexual abuse under the age of 12 by mandate, by agreement, by our protocol. So we are the responsible entity in the city of Chicago, and we should be getting any report of abuse, child sexual abuse that falls in that category. We get about 2,000 reports every single year. We've been open since 2001, and we are one of 39 children's advocacy centers throughout the state of Illinois. Illinois has all but a few counties covered by children's advocacy centers, so the fact that our state is looking at children's advocacy centers as a part of the solution to this, I really appreciate that, because I think that we can learn from this crisis, this situation with Chicago Public Schools, and use this as a model and an example of how we can do something better across the state of Illinois. We are accredited by the National Children's Alliance. The National Children's Alliance is our national accrediting body, so all of us in Illinois that receive state funding are accredited by NCA. They have very clear standards of how we work together to investigate these cases. We're one of about 800 or so in the country. And because we're the city of Chicago, we happen to be one of the biggest in the country. And we have people that actually come and visit us from all over the world to learn what we do in Chicago. Because we are unique, but we are doing the work of other children's advocacy centers. And by the way, CACs are common practice. They've been around for over 30 years now. This is the way the Department of Justice has said is the best practice for investigating child sexual abuse cases. We've been partnering with the Department of Children and Family Services for many, many years. So with that being said, I think the first thing that we want to make sure of, and why we were called here today, is to make sure that criminal and child welfare investigations should be handled by the children's advocacy centers across the state. Every single children's advocacy center has this protocol and relationship. And anything that the public schools have to do, anything that Chicago Public Schools has had to do in terms of investigations should occur completely separately and after the criminal and child welfare investigations have been complete. I've heard a lot, you've heard a lot about delays in reporting We have seen this. This is our experience. We've heard this from mandated reporters, and we've heard it from when the cases finally get to the center that they might have had an outcry several weeks or sometimes several months before that. And our biggest message is, as soon as that first person hears about it, they need to call the DCFS hotline, and that way those cases can get to the Children's Advocacy Center as soon as possible. And we have an agreement between DCFS and our Chicago Police Department to communicate with each other pretty much immediately about those cases, and then we get those cases immediately and start working with them. One of the things that you heard Chicago Public Schools talk about their relationship with us and their request to us to provide services. So I won't reiterate all the items that they mentioned in terms of what we're going to do for them. A couple things I want to point out. We are a training entity in addition to a multidisciplinary team. So we also educate adults throughout the city of Chicago and even beyond the city of Chicago on their role as a mandated reporter. And we do a lot of education about signs and symptoms of sexual abuse and also outright primary prevention. So identifying what's been called here is grooming behavior. We call it yellow light behavior, but it's similar, so that we can identify those warning signs and teach adults in youth-serving organizations, what do you do when you see those things? We also do a lot of work on helping youth-serving organizations with creating codes of conduct, with cultural changes. We've worked very closely with Chicago Park District, for example. We have trained all of their employees over the last 4 years, from the person that mows the lawn to the people that do the work with youth, so they can understand positive culture and how to recognize some of these behaviors. And it's been a really great relationship, and I applaud the Chicago Park District for taking that initiative, not because there was a crisis, but because they thought it was the right thing to do. And we're doing similar work with Chicago Public Library. And I have called on, by the way, the City of Chicago and different departments that serve children within the City of Chicago to really look at more of an effort from the citywide aspect, because it's not just Chicago Public Schools, youth-serving organizations. I think if you did a little digging, or if our friends at Chicago Tribune want to do any more work, they might find some other problems in other youth-serving organizations as well. And we want to be ahead of that and try to help them as best that we can. The other thing that I wanted to mention is, this came up in some of the conversations, especially with the two young women that were so brave to speak up earlier. Our job, our desire here, and what I want you to think about as you look at any sort of possible state legislation that you could engage in, is we don't want these children interviewed repeatedly. I think you've heard that loud and clear. Neither do we. First of all, it's extremely traumatizing for a young person to have to go through these repeated interviews. We employ forensic interviewers. That's part of the Children's Advocacy Center model. Forensic interviewers are folks that have child development experience. Like our forensic interviewers, for example, have master's degrees in social work and forensic psychology and clinical work, child development. There's very specific training that is sanctioned by the National Children's Alliance as part of our accreditation standards that they have to go through. It's not easy to be a forensic interviewer. It takes a lot of practice and training and monitoring to be one, and so we're very, concerned when we hear about folks that don't have that kind of training doing forensic interviews of children, because our job is to make sure that they are cared for through this process so that the truth can come out in a way that doesn't traumatize that child further. But we also want to make sure that that truth is legally sound, so that our Cook County State's attorneys and DCFS can move forward appropriately with their next steps in terms of protecting these children. And we want to make sure that it's that this child doesn't go through repeated interviews, which could also harm the legal case moving forward into prosecution, or even with DCFS, or when DCFS has to, when there's appeals, so when they go through the appeal process. So every time that child makes a statement to somebody different, little teeny changes in the way the child says something, which is normal, by the way, because they're children, could be interpreted as, by a defense attorney, for example, as this child is lying, and I'm putting that in quotes, because I think we have to, first of all, start by believing every child that comes forward and making these accusations. So we want to make sure that the integrity of the criminal and child welfare investigation that happens within the Children's Advocacy Center is not compromised by something that occurs by some separate person, individual, questioning this child before they even get to us, or maybe even during that process, because it does take time to go through this process. So I'm not sure if there's legislation that could assist with that. We already talked about mandated reporting. It is a law. They should be reporting it right away. But we want to make sure that the school doesn't start their investigation until we're finished with ours to some degree, and that we can work together to share certain pieces of information to make sure that we have a full picture of what's happening in the school so that we can make sure, and I say we, I mean my partners with Chicago Police Department and DCFS, to move forward appropriately, and then what can we share with them? Because we've already done a forensic interview with this child. That's on videotape or DVR. We have had investigators at Chicago Public Schools request to observe the forensic interview. We are more than happy to work with them on that, to show them the interview. We just need to make sure there may be some policy issues or state legislative issues to protect that DVD, because what we don't want is that DVD bouncing around and getting out there to potentially the perpetrator, the alleged perpetrator. So that may be an area that we could work on together to make sure that there's sharing with our investigative process with the schools, but in a way that still protects that child and that child's forensic interview and whatever information that comes up in the criminal and DCFS investigation. So when I hear Chicago Public Schools, talking about their investigation, to me I'm thinking, the criminal and child welfare investigations, we need to make sure those are very clearly different and that those are like a first priority, and that they get those cases reported to authorities immediately. They can call 911, they can call the DCFS hotline. Those folks are required to talk with each other and make sure that those cases get to the Children's Advocacy Center. Another item I wanted to bring up is training. So I've heard a lot about mandated reporters and what they should and shouldn't do. We know the requirement by law. But one thing that we see at the Children's Advocacy Center is a lot of mandated reporters in schools. By the way, teachers are one of our biggest reporters for child sexual abuse, that they don't get adequate training in what it actually means to be a mandated reporter. So yes, they should know it. Yes, they signed something probably saying that they are. And there is a law now in place that teachers or school personnel have to be trained every 5 years in mandated reporting. But every 5 years is not adequate to be trained in mandated reporting. And, many of the folks that are working at Chicago Public Schools and other youth-serving organizations predate, these laws. And although they are mandated reporters, we don't know the last time they actually had any real training, in-depth training on what it means. We have the DCFS web training, which is actually very good, which is available to anybody in the state, probably not even beyond the state, that can look at that. But what we do, so we train adults in mandated reporting and what it really means on the ground. Because even though it should be something that professionals understand, when you are a person that is faced with a child or a situation that you're getting some weird feelings about and you're wondering whether it's sexual abuse or not, or any type of abuse, all kinds of things are coming into play with you as a professional. And it's not as easy as just being told you're a mandated reporter or looking at a webinar. We really work through some of those nuances of, what do I do if I'm not sure? What do I do if it seems kind of fishy? And so I went to my principal, and my principal said, don't worry, I'll take care of it. We hear these things. We hear these things from the teachers that we have trained in mandated reporter, that they're not sure a lot of times whether or not it rises to the level of child abuse. They're not sure because sometimes their schools say, you know what, you need to go to the principal and report it. And so they do go to the principal and report it, but then they don't know what happens to those cases, even though they should be reporting it themselves. Even though there's a lot of cases, as you've heard, that have come through Chicago Public Schools. There's 35,000 employees And they may deal with this once in their career. They may deal with this once a year. They may deal with it multiple times. But unlike us that deal with this stuff every single day, they may have gotten trained 5 years ago, and then 4 years later something comes up that is suspicious for them. I think that's too much time. And I think that they deserve training, and I think that if we're going to really look at prevention and making sure that they have all the tools necessary to be able to report not just sexual abuse, but all kinds of abuse, that we should look at maybe looking at the mandated reporter training laws a little more closely. Every 5 years is really a long time in between training. And there's a lot of other professions, by the way, that don't require any type of training at all in mandated reporting, even though the person is a mandated reporter. That goes in line also with Aaron's Law. I want to also clarify Aaron's Law. The representative from Chicago Public Schools mentioned that that was one of the items that we would be consulting with Chicago Public Schools on, but that actually is not part of our agreed upon service plan. So I just wanted to make sure for the record that that's clear. We are extremely willing to do that and have offered that, and I will go back to the table and offer that once again because we are in charge of responding to sexual abuse cases. We do it every day. Every year. We know what it takes for people to understand sexual abuse, and it's a multi-tiered approach. Aaron's Law is there so that children can recognize when something may be happening to them, because sometimes it's very, very confusing for a child as to what is happening to them when an adult starts to groom and starts to develop that relationship. It teaches them, at the very least, that that's not okay and go to a trusted adult. I'm totally simplifying it, but there's different ways of training this from literally kindergarten through 12th grade. But you can't do that by itself. Somebody mentioned it's not the child's responsibility, and I totally agree with that. It's not the child's responsibility to keep his or herself safe. It's the adult's responsibility to do that. And so Aaron's Law is one piece of it. And even though we have done trainings in some of the public schools and CPS, not all of them. We have not done training in all of them. We just haven't been asked to do that. And we don't have the resources, frankly, to do Aaron's Law training in every single school within Chicago Public Schools. But we are more than willing to consult and help them with their own training and their own rollout of that. Aaron's Law is not funded. It's a mandate, but it is not funded. And we want to make sure it's being conducted by the right people that have ability to train and educate kids in a way that is child-friendly, developmentally appropriate. It's not easy to sit in a classroom and teach a child about sexual abuse. So you have to have somebody that has a comfort level and ability to do this and not be afraid themselves to bring this out in front of a classroom. We also need to make sure that if it's a teacher or a social worker or a health professional doing it, that they know what to do if a child then raises their hand and says, hey, this is happening to me. So, we need to take it to that next step. We also need to then make sure that the adults that are working with these children every day do understand what it really does mean to be a mandated reporter, to understand what a credible suspicion of sexual abuse looks like. Our message to people is, if you have an idea of it, call. You don't need to figure it out. I heard somebody say earlier, kind of figuring out whether it happened. No. That's our job. That's the job of Department of Children and Family Services and law enforcement. That's their job to figure it out, not anybody from the schools or anybody else. And we ask, if there's any way to strengthen that expectation from our schools, I think that would be important. Another thing to bring up would be, there's some talk about licensure and certification. So if you're looking at ways to enhance or make sure teachers are getting trained in mandated reporting, that may be something to require with recertification. So maybe there's some requirement around, if you get your license, your teacher's license, that you have to prove that you went through a mandated reporter training. It's kind of like, I'm a social worker, so I know, when I go through my process to get my license renewed, I have to prove that I've had X number of hours of training. Well, why not require that mandated reporter training as one of those trainings? not just for teachers, but for social workers too, so that we can ensure at least every 3 years somebody is looking at this, from a regulation kind of basis. So that's one. And the other thing, this is probably maybe going a little too far, but, all of our educators, maybe we can look at curriculums within universities for teacher education classes because, they just aren't getting trained in this way until they're really walking into the school for the very first time and being told that they're a mandated reporter. So it's another area that I would suggest. Another thing that, I'm working with Chicago Public Schools on is just the protocol. So somebody referenced the Cook County protocol on how we work together to do sexual abuse cases. And so that protocol is under the Illinois Children's Advocacy Center Act law. And that law is 30 years old now. It was we did do some work on it about 5 years ago, I'm trying to remember now, to strengthen some of the language in the Illinois Children's Advocacy Center Act. However, this may be time to look at that again and look at the inclusion of schools in that act to make sure that they have a seat at the table in an appropriate way. I've had several discussions with my multidisciplinary team leadership, including Chicago Police Department leaders, and of course DCFS leaders. We want to include in Chicago Public Schools at the table, but we also need to be very clear about that division of what these investigations are to not, inadvertently just, cause problems for the investigations that we're doing. So there's work that needs to be done to really clarify communication and how that communication is being used, where that communication goes. And that can be done by sitting around the table and looking at protocol county by county, because the way it typically works now is each county has a protocol, which is, again, described under the Illinois Children's Advocacy Center Act. So I think we'd love to work with you on what that might look like in terms of changes. Other than that, I think that, children's advocacy centers are here. We're here for you. Illinois should be very proud of the fact that we have 39 and that we have more than any other state in the country. And we want to see every child that's been sexually abused. We don't know what we don't know. So if they don't get reported, if we don't get contacted with DCFS, we feel very confident that we're always getting those reports from them. Frankly, we don't always know with our law enforcement if it doesn't come through DCFS if we're getting all of them. So we're just trying to keep working and striving to make sure every case comes to us so that we can handle them appropriately and correctly and make sure that these kids get the support services and the therapy and the healing that they deserve.
Thank you for your testimony. DCFS.
I am Deborah Dyer Webster, the Chief Deputy Director for the department. Basically, everything that I wanted to say has been said here in one way or the other. So for the sake of time and to leave time for questioning, I will waive my remarks, but I do want to give just one clarifying point, and that's in regards to the sharing of information between school districts. There's already a law that requires the sharing of that information. The requesting agency, the one school district must first request it, but if that information is requested, the school district receiving that request must. ANCRA states that they must share the information about any pending child abuse or neglect allegations, whether if they are pending or if they are indicated. If they have been unfounded, then the school district is not to share the information. A way to make that this portion of ANCRA stronger is to require a hiring district to request the information from a previous school district. Currently, it's optional, but if it's mandatory that they must request if there's any pending or indicated child abuse history from regarding an applicant, then that would strengthen the law. Thank you.
Thank you. So let me just take off on the sharing of information. And we're talking about sharing of information between
School districts.
school districts within the state or state and school districts outside the state?
Within the state of Illinois. This is ANCRA, so it's specific to the state of Illinois.
Okay, so right now, they must share that information unless it's unfounded.
They must share it if it's requested.
Okay.
Yes, that's the loophole here, is that I could be a school district hiring a teacher and not make a request to Chicago for that information. But if you make it mandatory that the school district, in their hiring process, request the information from any school district that the applicant has worked in previously.
Oh, okay. So now it's optional, but if they do request it, it should be shared with the school district.
Yes, if they request
If they
it,
request it.
the statute says it must be shared unless it's an unfounded report.
Okay. And how is that request made? Does it specify how the request is made?
No, it does not.
Okay. Since we're talking to DCFS, you probably heard me make reference to the manual for mandated reporters.
Yes.
And there's something here on page 11 that states that ideally the mandated reporter with the most direct knowledge of the suspected abuse should be the one to make the call. However, this is not a requirement. And
That is correct. The statute allows for that information to be shared with someone else, and that other person can make the information. The statute specifically says that, here, under no circumstances shall any person in charge of such institution, schools, facility, or agency, or church, synagogue, temple, mosque, or other religious institution, or his designated agent to whom such notification has been made, exercise any control, restraint, modification, or other changes in the report, or the forwarding of such report to the department. So with that last portion, or the forwarding of such information, allows for the person with the best knowledge to give it to someone else to forward to the Department of Children and Family Services.
Huh. So if I'm the person with the most knowledge, and I go to Jennifer and say, hey, I heard this, I'm not obligated to call. So is it more like tag, she said, she's now required to call, or who's required to call?
No, you're both, at this point, you're both
Oh, so you're tag,
required to
you're both
call.
required.
So you would be required to ensure, sit there with Jennifer while she make that phone call to make sure that information is shared.
Does it state, it says immediately, does it state what immediately means? Like, do you have to call right away, or do you wait?
No, we don't have a definition for immediate. But a reasonable person would, immediate
reasonable
means
test.
right now, as soon as you get the information, that's the reasonable person standard.
Okay, so just because I share, let's say she's my boss, and I share the information with her, I'm still responsible for making sure that call is made
Yes.
to DCFS.
Yes, and that's part of the training that Shara was talking about, how to really operationalize what you learned during the mandated reporter training. It's like, it's your responsibility to ensure that this information gets to the DCFS hotline.
But someone has to make the call.
Yes, that
Okay.
call has to be made, yes.
So can you walk me through the process? Let's say your office does get a call, right?
Yes.
And you're open 24/7?
Yes.
Okay. Do you have the resources and the capacity to take those calls? The volume, is there a huge volume of calls coming in?
Yes, this, why don't you introduce yourself?
Good afternoon. I am Nora Harms-Pavelski, and I am the Deputy Director over Child Protection. And part of my duties are overseeing of the Child Abuse and Neglect Hotline, which is what you're referring to. So yes, our hotline is open 24/7, 365 days a year. We man it. We have had some phenomenons lately that numbers are increasing in calls. Just last year, fiscal year, we had over 252,000 calls to the hotline alone. 65% of those calls were made by mandated reporters, the largest groups being educators, medical providers, social services. They comprise the largest groups in law enforcement. So having the resources, yes, we have the ability that if we cannot answer the call, we can triage our calls, and that's what we do. So if our call volume is high, a caller will always be met with a live body. They'll talk to them about the call. They'll ask them if they've got a child right there, if it's an emergency. Do they have a child that's injured? Are you law enforcement holding a child? Are you a medical provider holding a child? Those we consider emergency calls, or if a child themselves call. We will never let a child off the phone. And we will take those calls. So that if we cannot manage a call right now and they say it's an emergency, we will ensure a callback within 15 minutes to that caller to ensure that we get back and we can ensure the safety of the child. So once that call is made, they're transmitted to the field within an hour. And that, again, is 365 days a year, 24 hours a day. So we have staff there after hours and on weekends so that we can ensure the safety of the children and work closely with our law enforcement partners, with our Child Advocacy Center partners in working these investigations.
So at 252,000 calls a year, it's just an average around 690 calls a day.
Around 600 to 900 calls a day. We have a lot of 1,000 call days right now in what we call our high time, which is when school years are starting and school years are ending. We can have up to and over 1,200 call days in that 24-hour period.
How many people do you have answering the calls?
Right now, we have approximately, I want to say 104 people. Now, but you have to remember that those are on shifts.
Right.
So that while we have that maybe entire staff, we maybe have 45 staff to 50 staff during the hours of 8:30 to 5 when the most of the call volume comes in that are available to take calls.
Do you keep track of the calls coming in terms of the average wait time, dropped calls, call busies?
Yes, absolutely. We actually have what we call a scoreboard or a monitor that sits up so that in real life time, we can see how many calls are coming in, how many calls are waiting right now, and how many have been abandoned. And then we get a report of that on a daily basis so that we do keep track of that. We do a weekly report and a monthly report because it helps us assess what we need in the way of staff and what our wait times are and what we may need to do in order to beef that up in order to answer those calls.
So, two questions. On an average day, what's the average wait time for a call?
I would have to look that up right now. I don't have that right here with me.
Okay, if you can share that with us, and then, and your high water mark, when you get to 1,200, what's the average time?
Absolutely.
Abandoned calls, what percent of abandoned calls do you have during certain parts? I imagine you have some kind of tracking system. There's several out there that keeps track of phone calls and how many are in queue.
Right.
If you can just share that with the committee, and we'll make sure we pass along to the other members.
Absolutely. I can get that to you because, like I said, we do a weekly, monthly, and a yearly to-date fiscal report. So all of that information is available. And I will make sure that we get that to you. One of the things I'd like to clarify, though, of all those 250,000 calls, only about 30% of those calls actually turn and meet the criteria for an investigation. So if you take a 900 call day, then that means about 300, about 30%, so a third of those calls actually turn into investigations on a daily basis. The other calls are handled differently. They may be referrals out to community services. They may need a connection with law enforcement. They may need a referral or a connection out to our Child Advocacy Center. So only about 30% of those calls. But of all the calls that come in, about 65% are from mandated reporters.
So on the front end, you have the hotline, calls come in. And that 30%, I would imagine you need to send someone out there to the field or someone to investigate, correct?
Correct.
And are you adequately staffed to do that?
We are working on that. Right now, we have just a couple hotspots in the state that we're working on and trying to staff up. That's our Rockford area, our Waukegan area, and our Freeport area. We just have problems that we don't have candidates on our lists to offer positions to interview and offer positions to. We did go through, because of the calls we've had over the last 2 or 3 years, we've had about a 12% increase in calls versus for the last 10 to 15 years or even 20 years, it's been about a 2% drop every year. So we had this phenomenon. So the first year that we went up in calls, it resulted in about 10,000 extra investigations that we had to handle. So we weren't adequately staffed at that time to manage that influx, but we have since, and with the director that we have now, we've put places, what we call pipelines, so that we have staff in place, trained, and ready to go when we have those vacancies there. So we're not having the delays like we had before, where we would have to post the position, then we'd have to hire the candidate, then we'd have to get them trained, and then, fill the vacancy. So it's a lot more streamlined now, so that as a vacancy becomes open, we can move one of these pipeline people or these deferred assignment staff that we call them into one of those positions.
Do you have to go through CMS?
We worked with CMS and we worked with the union also.
Okay. And I'm sorry, you said Rockford, Freeport, what's the other?
Waukegan.
Waukegan.
Mm-hmm.
So when there was the budget request, are you budgeted adequately to meet the staff needs?
I think we are at this time.
Okay, I'm hearing voices now. Okay. Okay, we'll probably just drill down a little bit more later on in terms of logistics, how many people you have on the field, delays, and problems that you're having there. And real quickly, let me go over to Shar, number one. I just want to make sure people understand you're not looking for business. I invited you to come to this committee meeting. I used to sit on the board for the Northwest Children's Advocacy Center, so I understand the great work that you guys do. I just had assumed that we did this throughout the entire state, with the exception of those 2 or 3 counties where we might not have a CAC. And you made a statement that you had reached out to Chicago in the past to offer your services.
To Chicago Public Schools, yes.
And you're working now with the Park District, correct? Chicago Park District.
Yes, so we have over the years, reached out to all of our partners that within the city of Chicago
Okay.
that serve youth in some way, just offering.
When did you start reaching out to CPS?
Oh, we've probably 6 or 7 years ago, with different departments, educating them on our services, what we could provide. Especially when Aaron's Law came out, we started
Right.
kind of pushing things out, especially to their Office of Student Health and Wellness. It's been our main contact.
Okay. The county protocol, which I referenced earlier and you mentioned, was signed off also by the Chicago Police Department. So they're working with you. So if they have child abuse cases, they call the Children's Advocacy Center.
Yeah, so in Chicago, they're right with us in the same building. So we actually have a special investigative unit.
You have the Chicago
housed.
Police Department, Sheriff's Building with you.
Yes,
And you've been reaching out to CPS now for over 6 years.
yes. And so has Chicago Police Department, to reach out to them to train their officers, for example. We've done.
I'm sorry, you said Chicago Police Department has reached out to CPS,
Yes,
offering their services.
offering to train the officers that work in the schools. And they have provided some training. We did one training, we co-trained with them about a year ago.
So you've been offering the services. Now, I understand that Dr. Jackson did reach out to you, and there was a meeting, and I guess there's an understanding or an agreement to perform certain duties for $150,000.
Yes.
Is this $150,000 for the year or for just a program?
I actually don't know. The $150,000 that was quoted at the press conference, that was the first I'd actually heard that amount.
Okay.
So we have a meeting that's not yet scheduled, but we're looking at next week to look at an actual implementation plan. What we provided for them is an array of services.
There's a menu selection. I understand. So what can I buy for $150,000?
Well, we're a not-for-profit, and we there's parts of our services that we're going to provide anyway because we are an agent for abused children in the city of Chicago. So a lot of the things that we're offering them, by the way, are just for free, like access to our mental health system, like consultation around Aaron's Law, like including them on the multidisciplinary team. And we're also going to be convening a group of community providers so that we can do a more collective response to, because there's a lot of community agencies that are in the schools already, working with kids in different ways. So we also want to collectively help kind of blanket the school with some trauma-informed care. All those things we're just offering because we feel it's our job.
That's what you do.
Right.
Just like
So to answer your question, we've outlined trainings, and I didn't bring my actual schedule of fees. We can probably, with $150,000, we can create for them a webinar, which is something that we offer to do in our service plan, an interactive webinar so that they can, ongoing and over the course of time, train staff with mandated reporter. And we want to make sure it's interactive and has a pre and post test and not just something, that you can multitask while you're completing it. We also can offer, what we need to do is get down to how many trainings we can offer them for that price and what kind of consultation we can give them.
Can you do this committee a favor? Could you, let's say in a perfect world, right? Because I honestly believe that if the Children's Advocacy Center played the lead role in these investigations, that this will solve the problem. You guys can do the training. You guys can conduct the interviews. You have a relationship with all these other agencies, CPD, they share office space with you. If you give us some kind of idea, how much, and I understand you're a non-for-profit, you're going to do the work no matter what, right? It's very difficult sometimes, especially when they make cuts to save for the start, save from the start in other programs. I understand that. Ideally, how much would we need to invest to make sure that CHC in Chicago play the lead role in these investigations? I assume you work closely with DCFS. There's not an issue there where, okay, so it's a nice marriage. That's good. It would be nice to know what would it take, because listen, it's the same thing I heard from CPS when we're looking into special education. They made a promise, we're going to hire 65 special ed employees, which was inadequate, but people bought that. 4 months later, they were short. They didn't even get to 35. But they bought time. It's really interesting to me that the $150,000 that was quoted in the paper, you didn't even know about this. I thought that this was something that you guys sat down and you talked about what you can offer, and you figure, hey, we were going to quantify it this way, this is how much, but we don't know if that's adequate or not. It's just a relative number. But it would be nice to know. I know I've asked staff to reach out to your staff, see if we can somehow craft some legislation to have you guys play a bigger role, because I think that pretty much solves pretty much the entire problem. And the fact that you've been reaching out to CPS and offering these services for 6 years, and it's not until now, because it's a crisis and they got caught, now they're reacting to it. And I'm not even sure if what they're offering and what listen, it looks good on paper. That's all it is right now.
May I point something out?
Don't make me mad anymore, but go ahead.
It won't make, hopefully it won't make you mad, it'll give you hope. Chicago Public Schools is so large, and what happens is each of these schools really functions as their own little kingdom. Principals have a lot of authority and a lot of control over what happens in their schools, So we've had many, many schools just reach out to us on their own. So we've had at least 25 schools in the past year, couple years, that have just called us and said, you know what, we care about this, we want to train our staff, we whatever control they have over their budgets. And by the way, we've pretty much done all of this work for free. So we have gone out and trained their teachers, given them consultation. We have a very extensive project in the Brighton Park neighborhood right now. We've been doing it for 2 years, where we tried to get grant money, we couldn't get it, so we just decided to do it anyway. And we've done Aaron's Law training, support for parents, support for teachers, training them on mandated reporter laws, and then over the course of time, because it can't be a one and done thing. It has to be something over the course of time that is integrated into their processes. And we have, and I can share this with you, I don't have it in front of me, and we did a white paper and an evaluation on what happened in Brighton Park so we could learn what's helpful, what's not helpful, so that we can duplicate this. And really the reason we were doing this is to show Chicago Public Schools that this can work, that this is important, and also to go out to the private sector and say, would you fund us so that we can help Chicago Public Schools? So we've done a lot of work trying to get other people, other private funders, because government, by the way, pretty much will not pay for prevention. So we can't go to our government sources. Some will, but not in any sort of extensive way. So all of our education and prevention work is 100% paid for by private donations and one private grant. So that's what we did, and to show, and we still work in Brighton Park schools. So there's lots of schools that call us and want this, and so when I speak about mandated reporters, our teachers most of them that I talk to and that come to our trainings want this so badly, and they're confused and they're wanting help, and as you heard, they're our biggest reporter, so we need them, because they're not only reporting, they're not reporting on each other. Mostly, they're calling to report on a child that comes to them about sexual abuse that's happening somewhere else in that child's life. So I want to make sure that we're partnering with them closely, because they're a tool for us to protect kids.
Okay, thank you. Representative Flowers.
Thank you, Nora? Okay, you're Nora. Okay, I just want to try to get these names correct here. The Child Advocacy Center. All right, okay, my paper must be mixed up. I'm sorry, what is your name, please, for the Child Advocacy Center?
Shar Rivette.
Shar, okay. First of all, I want to thank you for having your organization. I remember when you first opened, we were at your ribbon cutting, the speaker and I think we gave a grant to help open the doors back in those days, and it was a beautiful place, and I was just saddened to know about all the sad things that was going to happen, but I was glad it was that type of environment, because until you came along, it happened in the police station or under a desk someplace with DCFS, so those were horrible days, so thank you very much. And I appreciate the fact that you will be working with Chicago Public Schools. But now, are you working for them or with them?
We're working on a service contract, so they're going to be contracting with us to provide services to them.
So when there is an allegation from a child and someone reports to you about this allegation, walk me through what will happen.
So the system won't change from what it's supposed to happen now. So what's supposed to happen is a report goes to DCFS, not to us, but to the DCFS hotline or 911. So we educate people, if they can't remember the DCFS hotline, then just call 911, and get that report out there. So the services that we're providing that are different than what we're doing now are really more around the training and consultation and including them in some protocol for how we can work together more successfully in the future. The whole process of investigations, that continues as is. What we're concerned about, though, is that they're not getting to us. So what we want them to understand is call the hotline, call 911, then those cases will get to the center, and then we will work with you on what happens moving forward.
Well, when you say things are not going to change and the investigations are going to go on as they are now, I hope not, because right now, their law department is doing the investigation.
To clarify, what I'm talking about is the criminal and the child welfare investigations that are being conducted at the Children's Advocacy Center. So my concern has been, and I think it's been raised by all of you, is the law department investigation is completely separate from the criminal and child welfare investigation. And we need some separation there, because the job of DCFS and the job of law enforcement is to investigate criminally or from a child welfare perspective. We basically want Chicago Public Schools to stay out of it up until we're finished with that, because that's the law. That's how it's supposed to happen, but it only can happen if they report it. So they have to report it quickly before they start interviewing that child, get it to us, and then we will basically work with them like, okay, here's where we are in the process. Here's the forensic interview of the child. Work out some legalities of what we can share with them so they can actually watch maybe the forensic interview of the child and not have to interview that child again.
If, under your scenario, and maybe I'm wrong, is the child being interviewed twice? Once by the law department and then by you once they contact you? Because my vision is that because you're bought in, the law department will cease because they're not qualified. They don't know how to, and they do have a conflict of interest. So I would imagine that how the law, my interpretation of the law, is that the mandated reporting to DCFS and or call the police, and then someone from those two entities will then contact you.
Correct. And the way it happens in Chicago, it's kind of simultaneous because we are all together in one building and we have a collaboration. So it happens basically in real time. That's going to be, our law enforcement is going to be contacted, our DCFS is going to be contacted. Whoever gets it first shares it with the other, and then they share it with my department, my agency as well. So I don't want these children to be interviewed again. In a perfect scenario, a school official, a school person, a teacher, whomever, will first find out about the abuse. They will make sure the child feels supported, like, okay, I hear you, start by believing. It's one of our mantras. They will probably go to their principal. I'm sure that's something that's going to be common practice. But within that time frame, they're going to get on the phone. They're going to make that child as comfortable and safe. I love the idea of having some sort of an advocate or a social worker with that child. They're going to call the hotline, which will activate the system, as Nora mentioned. That system happens quickly, and depending on the immediacy of the situation, it'll be basically dispatched to Chicago CEC if it happened in the city of Chicago. What we would ask the schools to do at that point is nothing, so to speak, in terms of their investigation.
Like they're doing now? Right.
Well,
okay.
You know what I mean, I think.
Yeah, I know.
We don't want them to interview the child. We don't want them to do anything that would possibly harm the criminal and child welfare investigation. But what we do want them to do is make sure they're communicating with our multidisciplinary team, whoever that is, if they need to figure out who that is, like if it's in their Office of Student Health and Wellness, if it's their investigative piece, just so that we can know where we are in the process. And so they'll know when to take, because my understanding is then they still have to do some sort of investigation to determine what they need to do in terms of disciplinary action, et cetera, for the employee, which is a different thing. But they should be using all the evidence that we've collected to make their decision. There's no reason to re-ask that child all the questions that our forensic interviewer already asked that child. Mm-hmm. And the other thing we can do is work with them to say, there's a few things that we know that would be helpful to you in your investigation, that we may want to tell our forensic interviewers to ask during the process. That's good preliminary kind of, we call it, the the pre-forensic interview conversation that we have, because they may have some information that maybe the DCFS investigator doesn't even know, or the law enforcement person doesn't even know, because it's all pretty, fresh. So tell us everything you can possibly tell us so that the forensic interviewer can be very comprehensive in his or her questioning. And then, like I said, that's all on DVD. That can be viewed, by CPS investigator, whoever's doing it, whoever, if it's the Inspector General, is going to do that. But I just want to make sure that there's some protocols in place, because we don't give that DVD out. That is a piece of evidence. That's a piece of evidence for the criminal trial and for DCFS. And so we have a lot of safeguards as to what happens to that piece of evidence. So we want to make sure that's protected and not just handed over, to the alleged perpetrator or anybody else for that matter.
And my next question, and I want to just be clear about the follow-up information. You will not be reporting back to CPS anything that the child is telling you or you're learning about the criminal investigation or the alleged investigation.
We would not be doing that, no. Now, what the DCFS investigator and the detective, they may be communicating because it's just part of the process of the investigation to learn what's happening, and so that CPS can decide what their next move is in terms of whether they suspend the person or whether they, make sure the person's not in the classroom anymore, because they should be using the information that we're gathering to protect that child at school and to make sure that that alleged perpetrator doesn't have access to children, which
Right.
has certainly been a problem from what we've heard.
I agree. And so my final question, the Child Abuse Neglect Act, there is a distinction between an abused child and a child that's victim of a sexual crime. Can either of you elaborate on that, please?
So a child who is a victim of a sexual crime
Yes.
is also an abused child.
Under the Child Abuse and Neglect Act,
Yes.
there was a court ruling back in 2013 that the Illinois Appellate Court decision offered an example of the significance of the element of the definition in determining whether a child is abused. DCFS has determined that an adult committed abuse within the meaning of the act. And one way that that adult did violate the child, if that child was 16, but the child was not in the home with the abuser, but the abuser was a teacher. And then there is the Child Abuse and Neglect Act, where the child is in the home and in the environment with the perpetrator and being constantly abused. The child that was sexually abused at school was a child that was sexually abused. And it's a mandated reporting, as well as the child that is sexually abused in the environment of the home by the boyfriend or the relative or just being beaten or something like that. So from my understanding with CPS, some teachers was thinking that all they were supposed to do is call DCFS, but they was concerned because DCFS wasn't coming out to investigate. And the reason why you guys wasn't investigating, because that child parents was not abusing the child, and they thought that CPS or the child's parents would call the police.
So I would have to read the case and consult with DCFS legal, but the only distinction I can even possibly think of is that an abused child, the definition of abused child in ANCRA refers to conditions in the home, a peer more or someone living
Right.
in the home.
Right.
in whether or not it's sexual abuse or not depends on whether or not that person was some sort of caretaker
Right.
for the child. So I don't know I don't know the circumstances of the case that you're talking about,
Right.
so I won't speak on it, but I will look at it and we'll
But,
let you know.
the definition of the caretaker would be because that child was in that adult's care while they were in the school.
Yes, and DCFS would
Yes.
investigate that, yes.
So, and the child was abused by that particular person, but not by the family, so. But that was the discussion that I had earlier, and I just wanted clarification on that. Okay. But if you could look into that case and get back with me to get clarity, I would appreciate that.
Yes.
All right, thank you.
Thank you. Senator Resin.
Thank you, Mr. Chairman. One question. Did I hear in your testimony that you are recommending them, because I hear from CPS that their law department is still part of this process, and they are meeting with the victim and interrogating, in my opinion, but it's your testimony, you're saying that once this, victim has come out and, told whoever, the principal, their teacher, what has happened, you're saying that the proper protocol should be to call you and let your trained experts in dealing with these situations come in and interrogate because you're trained for this. Is that what I just heard?
Yes, and they would be calling the DCFS hotline and not us directly. And if they did call us directly, we would just talk them through it and make sure they called the hotline. That is our preference, and we would prefer, and it's the law. They have to call, and then the way our protocol is those cases would come to the Children's Advocacy Center, and it's across the state as well, so Kim can speak more to how it occurs other parts of the state, but we would then forensically interview that child. And we make it very, I don't like it, but the word that you used, interrogation, is certainly what I would not describe happens, at the Children's Advocacy Center. If that's the way I have concerns that it's happening in that way, it has been
I
anyway.
think that's the way it was displayed in earlier
Yes.
testimony, so that is my concern, and I do appreciate, again, it's important to have an expert, an advocate at the table who understand, who's trained for this situation. So I do appreciate your testimony, and what I've heard is that once this victim has come forward, that almost immediately, someone with your training should be brought in, as opposed to having the case go to the law department of CPS for further interrogation.
That's absolutely my recommendation.
Thank you.
Thank you. I guess DCFS would agree that this is almost a best practice following this protocol, correct?
Yes, we agree.
Okay. I also want to quickly recognize Kim. I can't pronounce your last name, Kim.
Mandaracino.
And you just took over the Children's Advocacy Center, Centers of Illinois just recently, right?
Correct. I'm the executive director of the Children's Advocacy Center of Illinois, which is a chapter agency for all. We now actually have 40 CACs,
Okay.
39 of them accredited, covering 98 of 102 counties in Illinois.
And I think once we have our second subject matter, and hopefully we'll get Dr. Jackson and the mayor's office here, we might invite you to come again so you can give us brief us on. We understand CPS very well after today. I understand Northwest suburbs because I sat on their board, but some of the challenges that we have through some of the other counties that the capacity, the resources might not be there. So, but I appreciate you being here with us.
Very happy to do that.
Thank you. And Char, very briefly, you heard in some of the testimony today how the law department of CPS was conducting those interviews. In a scale of 1 to 10, 10 being tops, 1 being like worst, where would you rate those?
Could I go in the negative?
Thank you. That's what I needed to know. Thank you for your patience. Thank you for your testimony. This was very helpful. I'm pretty sure we'll hear from you again. Thank you again.
Thanks for having us.
Thank you. Oh, so hold on one second. Senator Collins.
This will be very quick. In reference to Aaron's Law, you mentioned that it wasn't appropriated, but it wasn't supposed to be appropriation. It was supposed to be about the budget. So every school has a budget, and it was required for them to provide the instruction regardless of the budget status, not about appropriation. It was about what the schools get individually, and that's why some schools reached out to you. They were willing to use their budget line to do the training. So I just wanted to correct that. Thank you.
And that's what we call an unfunded mandate. Just because it's unfunded does not mean they're not supposed to do it. So, but you're right. Yeah, it's not bad. Thank you again very much. And then next we'll have CTU, Chicago Teachers Union. I can't thank you enough for your patience. It was supposed to actually be CPS here right now, but they had other pressing matters to attend to. So with that, I think you're the youngest one of all our witnesses today.
That
so.
seems to be the pattern in this in these 6-hour hearing processes.
Yeah, well, thank you for joining us today. Thank you for your patience. The floor is yours.
Good afternoon to the chairs of both committees and the members of the committees of the House and Senate Education Committees. My name is Kurt Hilgendorf. I'm with the Chicago Teahers Union. The CTU condemns in the strongest terms any abuse of children and unequivocally supports measures that protect children. That is our members' first priority, and as we just heard from the last panel, that educators are the single largest group of reporters to Child Protective Services of victims of abuse. And it is in that vein that I speak today to offer our members' perspective on how to best protect our students. It is clear from recent reporting that the process in the Chicago Public Schools to identify abusive adults and remove them from schools suffered serious breakdowns. The remedy from those breakdowns must include several key components. One, specific and transparent processes for staff, students, and parents to follow regarding sexual abuse. Including in these processes must be a fair due process for both students and staff. That due process increases trust for those who report abuse and makes reporting much more likely. Two, and was made clear from the discussion about the challenges of making reporting, is ongoing professional development for school instructional and support staff, including clear, regular, and embedded training about mandated reporting requirements, and for teaching students about how to report instances of abuse, either by adults or youth, including the requirements in Aaron's Law. The CTU's Quest Center, our professional development arm, can assist in that training if that would be something that is desired. Three, ongoing training for administrators and central office staff in investigation protocol to protect students from unnecessary rehashing of traumatic experiences and from intimidation that may shut down an inquiry. The same should be done for DCFS investigators or anybody else who's doing these kinds of investigations to make sure that students and young people are being protected and not re-traumatized. Our prime goal is that those tasked with supporting and protecting children have the best tools for their work. Four, appropriate staffing levels with trained professionals at schools and support agencies. CPS clinicians like social workers, school psychologists, school nurses, and counselors have caseloads several times recommended limits. We've seen the same workload issues in schools around the state. As state agencies tasked with protecting children and nonprofits who are just recovering from years of devastating budget cuts. If the district and state are to ensure that support for the whole child, including ongoing trauma recovery efforts, then there must be highly trained staff to do that work. And five, perhaps most importantly, we need follow-through from the district, and that's been a continued theme through today's hearing. CPS's recent track record on school closures and special education, just to name two issues, does not inspire confidence that the district is truly willing to invest the time and resources to remedy the issues the district faces. We encourage both the House and Senate Education Committees to use your oversight role to ensure that CPS leadership actually delivers on the promises that they've made today. The CTU welcomes the opportunity to work with both committees to develop legislation to address the issues brought out by today's hearing. With me today is CTU Staff Attorney Thad Goodchild, and we are available to answer any questions you may have. Thank you for inviting us to testify today.
Thank you, Kurt. Quickly, let me ask you, so the failure to report under the Mandated Reporter Act or law has been attributed to lack of training. Do you feel, what kind of training do teachers get now?
So the issue that we've seen is that that training on a whole variety of issues is irregular, it's not embedded in their day, and it's not done in a way that ensures that everybody's up to date on the latest developments. So the discussion we had on the DCFS reporting requirements, I don't know if that's something that's been communicated to staff in the Chicago Public Schools.
So currently, when are teachers trained on the mandated reporter?
So the best recollection, we've had discussions with our folks on the ground. It seems like it usually happens during the beginning of the year orientation, and that's it. And what's important about the training and why this matters is when we have situations that are highly stressful and potentially very dangerous, like the initial human reaction is to sort of panic, and the training is designed to overcome that panic. And that's why having the regular training, and so that it's regular, so that people are clear that this is what the process is supposed to be, that's why we're advocating that training continue. And be more than just once a year in the process of a 3 day information dump.
So currently, every year during orientation, these are new teachers and existing teachers, right?
Yep.
And you said there's a 3-day orientation?
Generally speaking, there's 3 days of like institute days. Now, those aren't all just training. Those are the 3 days before students come back.
And during that training or orientation, they touch on the mandated reporter law.
In my personal experience, it was very brief, and that the experiences and the discussions we've had with people say that hasn't changed much.
So it's not a lack of, so there is training once a year, but I think what I'm hearing from you is it's not, training is just training, but it's not adequate.
Correct.
And it's not adequate because of lack of time they spend on the training, or because of the content itself? Because we heard today from, I believe, DCFS, and we heard from Ms. Jones from ISB that it's not just like, hey, you're mandated to report when you see this, and it's a matter of understanding what it is that. So it's your testimony today that there is /training every year, but that it's not adequate.
Yes, and I think that it's clear that given that some of the what seem to be gray areas need to be very clearly laid out and regularly laid out so that people know when and how to report.
So when CPS says that we're going to train our staff, our employees, well, they're doing it already.
And we're doing trainings on special education, and they've also are supposed to be implementing Aaron's Law, and there's supposed to be a whole variety of other things that are supposed to happen.
And I'm playing that devil's advocate now.
Sure. Sure.
But would they say, hey, here's what I'm trying to reconcile, because I heard them go on record say we're going to provide more training, and I hear CTU say, well, they're providing the training once a year. So I'm trying to reconcile those two statements.
What I would say is that the training is inadequate, and that best practices on any kind of professional development are that it is regular, so over a series of time, that it is embedded in the work that you do, and that there's an opportunity to reflect on it and to put into practice. And what I'm saying is that once a year, as part of a 3-day information dump, is not the best way to ensure that training happens to make sure that kids are protected from predators.
Now, we heard testimony today based on the Chicago Tribune article that, and CPS pretty much attested to this, that they can't recall ever disciplining or filing charges against an employee for not following the mandated report law, which is somewhat troublesome. You would think that a school the size of CPS, that there would be some instances or cases where that would happen. In your opinion, do you think there's any reason why they haven't done that, or?
I don't personally deal with discipline, with employee discipline. I don't know if that has any thoughts on that.
I mean, I can't speculate on, how and why CPS carries out their duties in the way that they do. Sometimes my guess would be, it's the same reason that they're not conducting investigations of these matters following best practices in combination with, perhaps, bandwidth issues, focusing on other issues rather than looking at the abuse itself rather than, why wasn't it reported in the way that it should be. But that's a question for them.
What is CTU's, you heard the Children's Advocacy Center testify before us in DCFS. went on record saying that they believe that that protocol is perhaps best practice. Is this something that CTU would be okay with, or do you see this as part of the process you would have to negotiate with the district?
We are supportive of putting forth best practices on this in terms of reporting. I don't think that state law that requires reporting is really something that's subject to collective bargaining. We want to make sure that students are protected and that we're willing to work with all of the interested parties to make sure that that happens.
Okay. We have questions from, start with Representative Willis. Collins? Senator Collins?
Okay, thank you, Kurt. I want you to respond to when Morgan was presenting her testimony. She mentioned that she had also engaged with questioning from the CTU lawyer, and she felt it was harassment, and it was very demeaning to her because he basically had the same demeanor as the CPS lawyer or law department. So at what point does the CTU lawyer get involved in the issue? And in your questioning of the student, is there anyone else in the room, a parent, an advocate, or whatever?
Sure, I'd be happy to respond to that. So when one of our members who is a tenured teacher is facing dismissal charges, they can make a legal assistance request to the union. The hearing process under the school code are rights that are individual rights of all tenured teachers in the state, that don't stem from our contract, but legal assistance in those sorts of cases is a service that the union provides, but has the discretion on a case-by-case basis to decline. My understanding of the Sambordi case that Morgan was involved in is that the point at which a CTU attorney was questioning her was at the dismissal hearing itself. And my take on that case, I wasn't involved in it personally, but to my understanding, my knowledge about the case, is that the real breakdown there was the way that CPS handled the investigation on the front end, whereby the student was questioned by the principal, by multiple different CPS investigators, et cetera. And then when the case goes to hearing, you have in that instance, my understanding, a teacher who denied the allegations that were made against him, and a record of evidence that, by virtue of the multiple interviews, had a variety of inconsistencies. I haven't read the entirety of the transcript of that hearing. My understanding is that the line of questioning that the CTU attorney undertook during Morgan's cross-examination was inquiring about inconsistencies in the statement that according to the response of the teacher or who denied the allegations were indicative of a credibility question. And at the initial level in that case, the ISB hearing officer, the ISB appointed hearing officer, found that the allegations were not proven. The school district rejected that recommendation. Ultimately, that teacher was fired, and CPS rejected the hearing officer's recommendation, and that rejection was later affirmed.
So I guess I have a question in reference to, I might need to have Char, from her testimony, I would believe that you would prefer even not the child to be interviewed by the CTU attorney as well, once you've done your work or your audit, forensic questioning. Would it be your recommendation that?
Char, just for record, if you're going to answer, we should come up here on the microphone very briefly. If you can answer the question, please.
I can see how that's still traumatic for the child, and for some of the same questioning, the line of the questioning, what did you have on? Did you in a way flirt with the teacher? I heard that's what Morgan said, or maybe it was Tamara. indicated. So I would think it's still traumatic and psychologically damaging. Char, may I hear from you?
Yes,
What
and I
your
apologize, I
recommendation would
didn't
be?
hear everything that was said right before, but yeah, having somebody repeatedly interview a victim of sexual abuse is going to be traumatic and problematic, in my opinion, as a clinician and as somebody that works with abuse victims. I also, disagree with the type of questioning that puts any sort of blame on how a child behaves. Doesn't matter if a child's flirtatious or wears a skirt or does anything in any manner to provoke, and I'm again putting that in quotes for the record, behavior. It doesn't matter. It's a criminal act for an adult to engage in sexual behavior with a child, period. So as an advocate for children and as a clinical person, I would strongly advise that it's not in the child's best interest to be questioned in that manner and questioned repeatedly. We can work with, giving information necessary to the other parties that have to make decisions around staff and what to do with staff in a way that doesn't harm the child. So we can work on that and talk about that, but I would, as a child advocate, I wouldn't want to see that happen.
Thank you.
And I would offer just on that to the discussion that had happened earlier was that in terms of alternative ways of having a witness be present, in terms of in sort of having like televisual testimony, it's been a long day, to having the child testify remotely, to have an advocate testify to make sure that person is not testifying in front of the person who is the accused abuser, that we are open and supportive of all of those proposals. We're also open to changing the way in which that particular line of questioning might happen by someone who would be representing the CTU in that environment.
So let me just follow up on that then. So it might be a misunderstanding on my part. You said when a tenured professor goes before for any dismissal hearing, that, I guess the question is that a part of collective bargaining where the tenured teacher has that capacity to bring in an attorney on those issues? Is that a part of collective bargaining?
That's part of the tenure process. That's part of a tenured teacher's due process rights under state law.
Okay. So I would like to see if there is a possibility of us working together to tweak that or change that in reference to when there's a sexual criminal act or conduct involved. Would you be willing to look at when it's a sexual criminal allegation, that there might be some kind of exemption to that protection?
So my understanding is that's current law. That's an enumerated offense. If a teacher is convicted of it, they would be ineligible by state law to continue working and would be subject to automatic license revocation.
I'm not talking about the revocation of the license. I'm talking about in reference to, and maybe we don't even get that far if we have legislation that indicates that no one can interview the child except the Children's Advocacy Center, and maybe we won't even get to that point. But I feel that for the teacher in this particular case, what I heard, she was traumatized and questioned about her credibility in assessing the harm that had been done to her. That's problematic. So I want to look at the tenured, whatever you call it, what was it, the tenured what?
Tenured
Process?
teacher dismissal process.
Maybe there's something else we can do with the tenured due process.
I think that we, as I mentioned in the opening remarks, we are open to working on legislation to address these challenges. If there's a way that does it to narrowly address the issue of sexual abuse by a teacher against a student, which is something that is unacceptable in every case, that's something we're willing to work on.
Okay, thank you.
Senator Bertino.
Thank you. First, I want to say something to Shar here, and I think that was very important what you said when questioning. I guess this goes back to the attorney from CTU too. It doesn't matter what the child is wearing, whether they were flirting or not. We're dealing with an adult and a child, and it's a crime there and of itself. So I think that was really important to note. And now that was just a comment, but to branch off of what Senator Collins said, and I know you can't say this with complete affirmation, Kurt, but I'm going to ask you if you anticipate problems with the teachers' unions, or would they support suspension of a license while an investigation is occurring?
I don't have any way of speaking for the IFT or the IEA. I think from the CTU's perspective, I think we're open to looking at some of those potential options. And I know that there is a process now, to communicate that information to ISB. And while the and I'll let Thad speak to the specifics on what the investigation looks like once those allegations are made.
So, I mean, your question was, would be open to supporting changes in that regard? And my answer is, same as Kurt's. Absolutely, we would be, open to discussing ways to make sure that people who shouldn't be in schools are not in schools.
Right. And I'm asking this too, because there are obviously civil rights concerns that we have to take into consideration. How about fingerprinting, a fingerprinting database is statewide? Would you anticipate support?
We support the use of background checks now. Anyone who is hired by the Chicago Public Schools who is a member of our organization has to go through that. And so I think that depending on what the data issues would be, that we could, those would be relatively minor, I think, to get resolved. I don't know what that architecture would look like, but we are in support of background checks.
All right. Thank you.
Representative Flowers.
Thank you, Kurt. The two ladies, Morgan and Tamara, that testified earlier and stated that it was someone from the Chicago Teachers Union that was representing one of the teachers. And it is my understanding that the policies in regards to the firing the teachers is based on which union you belong to.
The firing process is governed by state law. And so the state, for a tenured teacher, that is covered by the tenured teacher dismissal process that the ISB panel had discussed in some detail.
Okay, so there's nothing in the union's contract that would impede a teacher from being fired or removed from teaching or being in the classroom or on the premise? There's nothing in the union contract, in CTU's contract. I don't expect you to answer
Sure.
other.
It's my understanding that that process is governed by state law.
Okay.
That's correct. And
Well-
the answer to your question is no.
Okay, I just want to be sure, because that was the information that I was given, and that was what was very concerning to me. And but if you find out something different, please let me know.
Absolutely.
And I'm sure we could work together on making those changes.
Yes, I want to reiterate that we are open to making sure that we can address at the legislative level what we need to do. We're also available to support training and ongoing, both on Aaron's Law for students as well as for our own staff to make sure that we don't have these issues going forward.
Well, because you do have the teachers at your disposal, do you not do the training in
So-
regards to character or protocol?
So the CTU doesn't do any hiring. All of that goes through CPS. Our professional development arm is open to any member of the CTU who wishes to choose an area of training. So we do everything from restorative justice training to national board certified teachers to math and algebra professional development. So it's a huge range of things open to that teacher who would choose on his or her decision what that person feels is best needed.
Thank you.
Representative Reich.
Thank you, Mr. Chairman. Quick question. Within your responsibility of zealously defending your client, in this case, a teacher who's abused or is accused of being an abuser, are you open to the notion of having a buffer between your attorney and the victim in this case, such as the Child's Advocacy Center, and running your questions through them so that there's sort of a buffer between what can be, I'm an attorney, so what can be a really nasty, kind of interaction, maybe that would be somewhat softened and probably would help get better information in the long run. Would you be open to your ability to modify your responsibility to defend your client and confront a witness in a way that allows that witness to not feel like they're being pounded on straight away by, for lack of a better term, an attorney.
Sure. I think we're open to addressing that to make sure that the young people who would be in this situation wouldn't be re-traumatized.
Okay, thanks.
Thank you very much for your patience, for hanging in there to the last second, so I appreciate that. We do have just one last, we have Ronald Jackson, and he'll have, Mr. Jackson, 5 minutes to tell us your story very quickly. And if you can just state your name for the record, please.
My name is Ronald Jackson. The disappointing part about this hearing is that Ms. Jackson can get on the radio, TV, and say how much she really cares and how much this really hurt her about the children, but yet she has not the nerve or the heart to be here to listen to the young ladies who were speaking about the incident that happened with them. And my only thing is that I wish the state would have froze the money to force her to come here to ask these questions. So I hope next time around y'all can get her here, because really an apology is nothing when you have the person here to address it. You can get on TV, but if you can't come face to face with a person and say, well, I do apologize, it's worth nothing. It's not worth you even saying it. The board has been using illegal practice for the longest, and it seems as if no one is coming forward. You have thousands of kids who have been abused, but yet due to no one taking up for them, that's why you have not heard much about it as now. And anytime you have to fight the board to get information about it, then it's a problem that the state needs to address. Partly the blame goes to the state before giving control to the mayor. You also have to take part of the blame. If we had an elected body, then those are the people that would have to answer. Just as you have to answer to your constituent, the people who have been an elected school board would have had to answer to the people of the city of Chicago, not Ron Emanuel or not Daley. They would have to answer. So I hope that you can push for an elected school board. And another thing is, the board also is using practice to bully people with the police. I have been up to schools where parents have been complaining about issues where their teachers been jumping on students, fighting. And when those parents come up there, the first thing the board would, where they would call their attorney, then the first thing the principal would do was threaten or have those parents arrested. And if you're a single parent and you have your child with you, you cannot afford to get arrested. Otherwise, the first thing they do is once you're arrested, they use the tactic, we're about to call DCFS because your child has been left. And that's what the board has been doing. I myself have been arrested at the school for advocating for my niece. When she did the right thing in saying that a student was stealing money, I went to the school, the board had me arrested. Ms. Hines, who also is on the board, she knows about it. Ms. Jackson cannot say that she doesn't know what's going on in CPS. You saying you was a principal, you saying you was a teacher, so how is it that you didn't know? It's the same thing with Miss Barbara Bird Bennett. She said it when they closed the 50 schools, she needed more time. How you need more time when you was working with the school? So that is the issue that is ridiculous for them to come up here and say they know nothing about this. And this is going to continue until something really going to blow over where a parent going to take matters into their own hands and do something really, I'm not going to say crazy, because that's your job to protect your child. And all the training in the world is not going to stop you from being a pervert. They're talking about background check. I did security. I had to go through the police station as well as send my fingerprints off to the FBI. The school board, this is no more than a cover-up for them to find a way to try to blow this over. And I'm saying to the state, do not let this go away, because in the end, when a child commits suicide because no one was there to help them, what are y'all going to say to them parents? There's nothing, neither one of you can say to the parent that would bring that child back because they was abused by someone who's supposed to look out for their best interests.
Ms. Jackson, thank you very much. You have 1 minute left, and I think Representative Flowers is going to take up that minute.
I'm sorry, sir, I did not get your name.
Ms. Flower, my name is Ronald Jackson. We have been at meetings before.
That's right. I just wanted to say
Because
for
I
the
had
record.
worked with Miss, just got her name, Miss Golark too, before she passed. And,
Right.
And I had worked with her a
I know
number of
who
times
you
on
are.
this
I just
issue.
wanted it to be known for the record. And I want to commend you because you are the only parent here today to speak for all those other parents. And so many times, a lot of parents wanted to come up to the school, but just like what was enunciated today, the principals would not allow them in, saying that the parents would be troublemaker because they would be angry because they were advocating for their children, knowing that they've been raped or harmed or something negative has happened to them. And CPS is good for threatening parents to have their children taken away. As a matter of fact, while I was watching the news, looking at Trump and thinking about having to come to this meeting, I was thinking about DCFS and how DCFS is the threat that CPS used to remove parents' children if they get out of line with them. So I understand exactly what you're saying. You're absolutely right. This has been going on for years. Thousands of children have been harmed, and a lot of kids are walking around today and locked up or on some form of drugs because no one believed them, no one trusted them. They didn't have anybody to come to. And so they're locked up or either dead or someplace in need of some medication because they didn't have any place to turn.
Well,
So,
if I could say
thank
one
you.
more thing, Ms.
Yes, sir.
Flower, now my children are grown. I was a single parent. I have 7 children, most of them 6 girls, so you can imagine the gray hair that I had with 6 girls. All of my children have graduated from high school. 3 of them had attended college. I have two stepchild who also have graduated from high school. But my question is, as I listened to the guy earlier about special education, that's another issue that need to be addressed. Because my daughter was a special education service, and I had worked with Ms. Collins to try to get her the service. She graduated, but yet she didn't never get the service. And I had custody of her, and it was in the CPS paperwork that the mother was not allowed to come there. CPS people called the mother, and they told my daughter that she didn't have to listen to me during this hearing.
Ms. Jackson, we're going to have another hearing on special education, so you're more than welcome to join us then.
will be
Thank you,
there.
and I agree with Representative Flowers. It's nice to see one of the parents stay here for the last 10, 12 hours, how long we've been here, and I appreciate your time. And I want to thank also all the members for hanging in there, too. And with that, we'll recess till the call to the chair.
And we did save the best for last. I just want you to know. Thank you, sir.